matters to you. So one of the other things that's happening is that counties have been described as the weakest link when it comes to fighting COVID-19. And joining me now is the Kiambu Governor, Honorable His Excellency Dr. James Nyoro. He's speaking to us on Skype. Mheshimiwa, thanks for making time for us. So first, that's where I'll start with you. There's been a description that counties are the weakest link when it comes to fighting COVID-19. Do you agree with this assessment?
Well, I don't necessarily. Thank you, Trevor, for having us. I don't agree with the statement because I think it depends on individual counties. As you probably know, when we knew that this problem is coming, and when we evaluated our position, being so close to Nairobi, we decided to dedicate one facility, that is Tigoni Hospital, to be a COVID center. And we closed the facility for other patients, and we started working on it. And I can tell you that we are prepared because we have over 225 beds in that particular facility. That is in addition to 60 beds that we have in our level 5 hospitals. So with that kind of preparedness and with the other aspect that we have a number of ICUs that we are activating over the next couple of days, we'll have about 50 ICU beds. I do not agree with the general statement that all the counties are ill-prepared for COVID.
So speaking for your own county right now, how many beds do you have, considering that you're supposed to do 300 beds in the next 30 days?
Right now, we have over 315 beds. As I told you, Tigoni alone, we had the old wing where we have about 76 beds in the old wing. We have a new wing that took a bit of time to complete. And in that wing, we have an additional 150 beds. If you add that to our existing facilities, that is Gatundu, Kiambu, and Thika, then we have 325 beds ready for our patients. In fact, as we talk now, a facility like Thika has had 9 patients, 5 of which has been discharged. Kiambu has had 4 patients, and I think 3 of them have been discharged. So we have about 325, and I have to tell you that we are not even comfortable with that. We'll be putting in additional facilities in Tigoni. We've gotten somebody who is working with us to put in an additional 100 beds. We are also working on the possibilities of putting, in fact, I think it should be in the next 15 days, we put a facility in Roiro, because as you know, when you look at hotspots, Roiro and particularly Githurai becomes a hotspot. So our target, Trevor, is that within the next 3 weeks, which is the time we were given by the president to get 300 beds, us will be having in excess of 600 beds in Kiambu.
Well, that's commendable, Dr. Honorable James Nyoro. But now the other issue is it's one thing to have beds. What about the human resources and the human capital that is needed to actually man those beds? Do you have enough of the trained personnel to deal with this situation as we speak?
We will have, we have enough personnel because, like, for instance, let's start with Tigoni. When we crossed Tigoni, what we did was we separated the personnel into 2. There was the personnel that we moved to the periphery facilities, that is facilities in Rukuma, in Rari, in Muru, in Deya, and in Rusigate. Those were to beef up the staff who are in those facilities. The patients now could not access Tigoni, and therefore we needed to revamp those facilities. But what we did was also to get additional staff from our other facilities so that they could be trained. I have to tell you that so far, we have about 1,700 staff who have been trained on management of COVID, including how to use ventilators, because it is always an assumption that any doctor can use a ventilator. And it is a very, very sophisticated and delicate case. So we have people who have been trained on that. As you probably know, we also have been recruiting. Through UHC, we recruited 195 medical personnel from across the board. We have followed that with recruiting an additional 100. And right now, the recruitment for the doctors and pharmacists are going on. So we feel comfortable. But I'll tell you, Trevor, nobody can be comfortable as far as health workers are, because you have to be very, very careful in ensuring that you do not infect your healthcare workers. You just need to make one mistake, and or just an accident happens, and that actually affected us in Kiambu, where one patient, they had not known that this patient was, COVID had COVID infection, and by the time they realized, a few of our staff had been exposed, and one person tested positive, and I can tell you that resulted into isolating 14. So you cannot be fully sufficient, because if you, if you have incidences of infection, then you have to isolate those staff, and that means that you probably may be running, short of the staff. But we
Yeah.
put in measures, like I can tell you, having realized the difficulties and having realized the risk of infecting the healthcare workers, we did came up with the protocol, particularly on triage of patients, that every patient who comes in
Yeah.
and is tested and is showing respiratory conditions is given our own mask, a surgical mask.
Yeah.
And then our staff obviously are using N95, they are using gloves to make sure that we do not infect our healthcare workers.
Okay, so that's on the medical side. Let's talk about the people of Kiambu now. What plans do you have to cushion them against the effects of COVID-19? There's a lot of intervention from the national government. In fact, there was a Kazi Mtaani pilot program in your county, allegedly. I don't know whether you've heard about it. But what are you doing as the governor and the CEO of the county to cushion the people who are living within the borders of Kiambu who've been affected by COVID-19?
One of the things that we did, actually, when we started this, Trevor, we looked at 3 areas. One was, of course, preparedness and response, which I think we've worked very well. The second one was prevention. As you probably know, we are very close to Nairobi, and we have to come up with measures to ensure that we prevent, opening of markets. We close markets to ensure that they keep distance, and we installed all the hand washing and sanitizers and so on. And that has worked out very well. Together with the roadblocks, of course, we had issues with the roadblock. Recently we had a problem with Kentimere roadblock, where you are blocking people from coming to the headquarters from Limuru, and we have worked on that. The third pillar that we looked at, and very, very important, is livelihoods. And if you can remember, Trevor, we put together a team of Kiambu people in order to help us think through and fundraise to make a appeal, particularly for livelihood. And this has to do with food. And I can tell you that that group that has been working, led by Chairman Eddie Joroge and the patron being George Muhoku, we've been able to raise a lot of food. We've been given a lot of food. And so far, we've reached about 15,000 households, giving them hampers of food to last them for a week. And that's not enough, of course. We have gone on and adopt a philosophy that you will be rolling out, and we are calling it Adopt a Village, Feed a Family. What we have done is to look at Kiambu and mapped it out. We now know, of course, we have 12 sub-counties, 60 wards, and we know that we have 27,000 vulnerable households. Out of those 27, they have been clustered in 600 villages. And we are now in the process of listing all the members, the vulnerable members of those, in those 600 villages. And we have started a program that we call Adopt a Village. And I can tell you that so far we have received tremendous progress using the committee that I'm talking about. And we have several villages, I cannot remember. Our target is over the next 1 week, we'll have over 9,000 villages adopted. Trevor, you come from a village. And if you are living in Nairobi, what we are saying is adopt the village. It will have 100 vulnerable people. Those 100 vulnerable people requires 2,500 shillings to feed for a month. It's 500 shillings to feed probably for a week or slightly more. So we are reaching out to people in Kiambu. We are reaching out to diaspora. We are using our own resources to make sure that we adopt and feed a family. So that's something that we are working on in order to take care of the current problem, the food problem. But let me tell you, we also feel as a county that COVID has provided us with another opportunity. And we want to move from feed a family to develop a family. We would want to move from feed this family and within the COVID and after COVID, would want to empower, economically empower that family. And over the next couple of days, we are sitting together to work out flagship projects. Let me give you an example. If you are in Gatuanyaga or in Goriba, where is arid next to Kambani, if you can be able to get 10 multipurpose chicken, multipurpose is the one that produces eggs and produces meats, that every household of those vulnerable type can have 10 chicken, they can be able to have about 24 eggs per chicken per month. And those are the kind of economic empowerment you start from the bottom of the pyramid. So we are working on that. We are also looking at aspects of aquaculture, that is rearing of fish, because we are close to Nairobi. We are looking at aspects of engaging the youth on greenhouses, and particularly using hydroponics because it uses less water. So we are rolling out an economic program that is going to be post-COVID that will have impact to the people. Remember also, like you said, Kazi Mtaani, and we are starting our own version of Kazi Mtaani, particularly in urban centers.
Yeah.
What we want to do is to engage some youth who will be doing some cleaning, but also labor-intensive public works, doing the roads, doing the culverts. Those are things that we are rolling out that we wouldn't have done if it was not for this COVID.
Yeah. So how will your Kazi Mtaani version work? Will it be rotational? Because I'm sure if you only involve certain youth for a long period of time, then others will lose out. How is yours going to work, and how are you going to decide who goes first?
We are still working on that, Trevor, but it will not be rolling. So what you want to have is a series of activities. So let's start with the Kazi Mtaani, particularly in our townships. We have about 7 municipalities. So each municipality will take a number of workers who will be in charge of cleaning those facilities. Together with that, remember that's not the only intervention. We are also having public works. As I said, our new contractors, the new construction of roads will be more labor intensive. We are setting up a road construction unit to start off one, which is run by the county with some graders, and that will be to ensure that we repair our roads. Remember, because of the rains, roads have been dilapidated, and that also will engage youth. So it's not that there's one lot of youth. I think there are different lots of youth. Remember also that quite a number of people have lost their businesses, including the hair salons, the people working in restaurants, even people involved in layering of chicken because the restaurants were closed. And we are working with banks to ensure that they can access maybe subsidized interest rates, loans on subsidized interest rates with some special arrangements. So it is actually a protocol of intervention. So it's not just one single intervention.
All right. And are you satisfied with the national government support to counties?
Well, we can ask for more. I can tell you that there was a point when we were very desperate as counties because we could not get, like for instance, PPEs. We could not get the masks, and there was a bit of talk that we'll get ventilators. And we could see that the government was kind of like struggling and all of that at the beginning. But I can tell you that the situation has improved. If you look at the supply of drugs from KEMSA, I can tell you, I can speak on behalf of Kiambu, that we have started receiving consignments even for UHC. So the situation is much more comfortable right now. We can ask for more. And I want to be very specific with you, Trevor, because look at Nairobi. We are getting all these cases because right now we have about 122 positive cases, although some have, have been discharged. We are getting all these cases because we are close to Nairobi. If you go to our hospitals in Kiambu and in Thika, you find many patients who are coming from Nairobi to our facilities. And what we have been saying is we had not budgeted for patients from Nairobi. And what could have been fair is if the national government could consider that we are in the metropolis and that we get additional resources. I also have to thank the president because of the 5 billion shillings that he shared to the counties. We got our share, and that is the share that we are using not only to increase the capacity of our COVID response, the beds I'm talking about, but we are using it to strengthen our level fours so that after COVID, we will be having facilities like never before. So we cannot be fully satisfied that we've received all of this support, but nevertheless, the situation has improved over time.
All right. And based on the impact that the cessation of movement has created, there's been a lot of talk that after the 30 days that the cessation of movement was still there and the curfew, that it should be lifted. As a CEO of Kiambu County, is that a good idea?
I think it's a good idea, Trevor, because I think what is coming out clear. It is unfortunate that we are talking about this when we are seeing increasing cases of infection. Would probably have been more comfortable if we had flattened the curve. But nevertheless, I think we are seeing situations where we have to live with the COVID case. I think the discussion you've had about courts opening is a clear indication that COVID cannot stop you completely from doing your things. What we have to run as government and as people of Kenya is that this is a disease that we have to live with. We obviously have to observe certain protocols. I think you've seen restaurants open and you walk in and you start to see that there's no longer that crowding that we had. So a lot will depend on how we respond. But I can tell you that if, for instance, like now we have opened the restaurant, if you look at the effect of opening the restaurants, there are some producers of vegetables, of poultry, who have now started coming back into economic activities, which could not have happened if the restaurants were not opened. So I think we can do well calculated opening up, but with evidence. I liked the way the president approached this, giving scenarios that if we open 20%, if we are careless, then we are going to have all these deaths. So for me, what will be important is the protocols that we put, even if it is churches, the protocols that we put. And if we do not obey those protocols, then it is an exercise in futility, then we should stop it.
So the reason I'm asking you this is because even if schools reopen or the cessation of movement is stopped, are you confident that the schools in Kiambu are equipped to work with social distancing? Is the infrastructure sufficient to handle the restrictions of COVID-19?
What I would probably propose, and there is a committee, I think there is a task force looking at that, including, you would ask the same question for churches. And what I'm happy about is that we are not rushing into this. We have individual committees that are looking at the protocols and the requirements and so on. My proposal would be that we do this gradually. I think there were indications that the school would probably open in September. The modeling is indicating that we'll probably be able to understand the overall situation of this disease, possibly by end of July, beginning of August. So if we, for instance, agree to open up certain other sectors, so we open up the hotels, in addition, then the transport moves faster, we remove some of the roadblocks because we need to rationalize the roadblocks that we have put in. We can gradually monitor and see what is happening, and probably schools in September would be the last ones to open. I think we have challenges in schools. Even before the COVID situation, our schools were crowded, just like matatus. And therefore, we had those challenges. So the question would be, without an increase in infrastructure, without an increase in classes, you are already encountering a situation that was already a problem. There was already overcrowding that time. So my answer to your question is we do it gradually. we learn from our mistakes, and probably the last areas to be opened will be the ones that are most complicated, and we have run through the process on how to go about that.
All right. Thank you so much for speaking to us, and all the best in dealing with the COVID-19 in your county level. That's His Excellency Dr. James Nyoro, Kiambu Governor, speaking to us on the county preparedness to deal with COVID-19. He says that by the end of it all, they're going to have more than 600 beds there in readiness to deal with COVID-19. This also goes in tandem with the human resources that they also have in the county, ready to deal with COVID-19.